Hi, good afternoon, all. Welcome to my presentation. So, here you can see past Jipmer 2020 Keypaper. So, let us discuss questions of it. The first question, the nurse Linda was monitoring a 25-year-old male patient who was receiving blood transfusion. On assessment, the nurse found that respiratory rate is 24 beats per minute and blood pressure is 90 by 60. And here abnormality you can see. We can see abnormality in BP. And which of the following is the priority action by the nurse? The answer is immediately the nurse should stop the transfusion. Okay, the next question. What is the full form of NITI? IOC is the National Institution for Transforming India. Then next question. Which of the following condition is an example of acute organic mental disorder? The answer is delirium. Delirium called acute organic mental disorder. Then next, fourth question. A nurse is analyzing the serum laboratory report for a client who has a lung mass that has metastasized to the pelvic bone. Metastasized to the pelvic bone. So, which of the following laboratory finding is expected? The answer is elevated calcium. Then next question. The patient underwent C5 C6 anterior cervical discectomy. So, which priority nursing diagnosis should a nurse document in a plan of care of this patient? The answer is potential ineffective breathing pattern. Then next question. Nurse Linda is assessing a patient who visited OPD with a complaint of smooth and redundant tongue and ulcers at the corner of the mouth. On inspection, she noticed that the patient has the following lab findings. So, which of the following is the most likely in this patient? The answer is low hemoglobin. Then, next question. A 60-year-old male patient who had a left total hip replacement was discharged from the hospital 1 month before. He called the nurse reporting that acute constant pain in the left groin and hip area and feeling like the left leg is shorter than the right. The nurse advises the client to come to the hospital immediately, suspecting which of the following condition? Here the answer is there is a chance for dislocation of prosthesis. Okay, then next question. The nurse Linda is caring for a child with hydronephrosis. Which assessment should a nurse perform to obtain the most accurate determination of fluid balance in this child? The answer is weighing the client. Okay, the next one. AFP is elevated in which of the following condition? AFE elevated in which of the following conditions? Spina bifida occulta. And the next question. Abnormal copper accumulation is seen in which of the following disease? Wilson's disease. Then next one. Which of the following location is appropriate to screen for jaundice in a child? Skin of abdomen. Then which of the following damage is most likely to occur during indirect laryngoscopy? The answer is damage to arytenoid cartilage. Then next one. 31st National Road Safety Week was observed on 11th to 17th January 2020. Then complication of high flow oxygen in preterm neonate includes retrolental fibroplasia. Then next question. When the patient is undergoing surgery under general anesthesia, which of the following parameter is the first priority? Have to check vital signs including saturation with pulse oximeter. Okay, then who discovered the value of pi? Archimedes. Then next time, which of the following medication is administered to patient preoperatively to prevent the infection? Antibiotic. Then which of the following chemotherapy agent is known as monoclonal antibody? The answer is rituximab. Then next one, epilepsy awareness day is observed on March 26. Then Pradhana Mantri Jan Dhan Yojana was launched on 28th August 2014. Then next question, nurse Linda has just received a post-operative total hip replacement client from the recovery unit. Which of the following position is appropriate for this client? On the post-operative side, on the non-post-operative side, or supine position with the legs abducted with the help of pillow. Then which of the following radio-opaque substance is used in copper T devices? Barium sulfate. Then next question, a 39-year-old male patient is admitted to the emergency department with dyspnea, tachypnea and pink fortis sputum. The nurse determined that the patient is experiencing, the answer is pulmonary embolism. The next one, all of the following side effects are expected in a patient with oral cancer who is receiving radiation therapy except. The answer is oral fluorosis.